Namaste, Salamat Datang, Salamat Malam, and welcome to Manthan with Saraswathi. We have been having various specialists on this talk show. And today, in continuation of the same, we have a doctor specializing in oral health, a tooth specialist in the episode, Don't Rush When You Brush, and to guide us through to keep our tooth fit and fine. So dentistry is the branch of medical science concerned with the diagnosis and treatment of disease and disorder of the teeth and gum. Dentists can not only solve problems related to teeth, but they also help us prevent gum disease and tooth decay. So it's very crucial for us to be provocative when it comes to our oral health. Seeing your dentist or our dentist on a regular basis will help us spot any problems early on and before they become a major concern. Why not ask a specialist with us today to get us more on these tooth-related issues? She also calls herself a tooth fairy. She is a young, budding doctor practicing in Jakarta, and she is Dr. Kirti Moorjani. Welcome on the show, Dr. Kirti.
Hi, Ms. Saraswathi. I am so honored to be here. First of all, being in your talk show, I think it's really exciting, and I think, it's going to be amazing.
Okay, before we move on, allow me to introduce her to you. And Kirti, I will introduce you briefly. And after that, you can start with your PowerPoint and we can start the show of question and answers. Okay. So Anna, can you just share the screen of Dr. Kirti? Yeah. So Dr. Kirti did her dentistry from Trisakti University. Dr. Kirti represented her thesis at one of the most prestigious platforms in Southeast Asia, that is KPPIKG. She also actively participates in international and national dental seminars and webinars. As her personal initiative, she visits schools imparting the knowledge of dental hygiene and its importance to young minds. She has been invited to multinational companies to emphasize the importance of dental hygiene and maintaining a perfect smile. She is also invited, to many other forums. And so we are very honored to have Dr. Kirti Moorjani, a young budding dentist in Jakarta. Welcome to the show, and the show is all yours. Now, Kirti, you can go on.
Thank you, Ms. Saraswathi.
Thank you, darling.
So let's start with the presentation.
Kirti, you're on mute, darling.
I hope you all can hear me.
Yeah, sure. Now we can hear you. Yes.
Okay. Okay. So for me, a happy teeth is a happy life. Okay. So let's see. Why is it so? Okay. So 50% of the people say that the smile is the first physical trait they notice. So, guys, it's really important to keep your teeth healthy. Okay. So it's not that you can pend it for later. So when you have something, your oral hygiene, when you're seeing something in your mouth, you need to get it checked immediately. So what is actually oral hygiene? It is keeping your teeth, gums, and mouth all healthy. Yeah. So it's not only white teeth, but it's also all the components of the oral cavity. So let's see something. So we'll start with, people having swollen gums. When they have swollen gums, how does it actually affect their oral hygiene? So the swollen gums can make the gums, recede, which makes in turn the teeth loose. and it shows a shift in the teeth. So this all will relate to bad and poor oral hygiene, right? So what do we do for this? And this is something which I wanted to share. Maybe I can share this later about how a tooth cavity becomes and how, it is important to brush your teeth. Okay, so what is plaque? So plaque basically is something which gets stuck in the teeth. After we eat, we all have bacteria which is stuck in the teeth. And after that, when we don't brush or when we don't gargle or we don't floss it out, this plaque gets into the gums. Okay, and then after that, you remember the diagram which I showed you before of the receding gums? Yeah, so, and tooth loss. So this plaque can actually lead to tooth loss. So can you imagine that just not brushing your teeth, and just missing a flossing, just missing a gargling can actually lead to tooth loss. So it's actually that serious. So what are the tips and tricks? Of course, very simple, but I would like to say that many of us are not doing this. If we do this, I think we can keep our oral hygiene to the optimum level, right? So we have to brush twice a day. We have to rinse well, and we have to floss, right? So for example, I just have like an animation over here. So we eat something, and then after that in the middle, there's like tooth stuck in it, right? And how do you take it out? If you don't take it out with a brush, you can take it out with a floss easily, right? So what are the solutions? This is me and my patient, and we have to check up every 6 months, floss, good oral hygiene, make sure you do the necessary treatments. If that treatment is supposed to be done for you at that time, then you might as well do it at that time rather than pend it. Because what I always say, and what we say as dentists, is that, dentistry is not expensive, but neglect is. So if you do the treatment at that time, then, you are sure to get good, good oral hygiene, and you would save on your cost as well. And you can ask me for advice, of course. So what are my simple rules? It's always FBG. Whenever people are asking me what's FBG, it's floss, brush, and gargle. Always have to floss after every meal, brush when you can, and gargle your mouth. So that really keeps all the plaque away to prevent the cavities. Yeah. And yeah, this is me and my patient. So yeah, be happy. That was a brief presentation of mine.
That was a wonderful presentation, I should say, Kirti. I think you covered up the most of the point. The best thing, I think, the takeaway from this would be FBG, which is the most important factor. I like the acronym also, the FBG. It's a floss, brush, and gargle, which is very simple. And I think if it followed, I think we don't have to visit a dentist, but you're on the show. So let's get moving. And you know what, Kirti, I'm so excited about the show because I have got a lot of questions. Some may be a very, very common question, which you often answer, but because on this forum, we have received them. So I think I'll, without wasting much of the time, let's hit it and let's listen to your suggestions and listen to your views on what the questions are. Is it okay? Can we start?
That's perfect.
Okay, that's it. Let's move on. Okay, the first question is from one of the mothers of 2 kids. And she has a question saying that I have 2 kids, okay? I have 2 kids who love chocolate. Who doesn't love chocolate? The kids, of course, love chocolate. So her concern is very genuine. I have 2 kids, both of them love chocolates. I and my dentist have tried explaining to them that it's very, very bad for the tooth, but they don't seem to understand and they seem to neglect it, it looks like. So they are asking, please let me know about the oral hygiene regime and how to take care of the teeth, because they don't listen to them. They want to listen it from the doctor. So your views on that, Dr. Kirti?
Very nice question.
Yeah.
So actually, first of all, I would never say chocolates are bad. I would say chocolates are good for you. Eat more chocolates. But what are you supposed to do when you eat those chocolates? You're supposed to FBG, floss, brush, and gargle. That way, the kids, what will happen to them is that they will realize that, okay, we can eat this, but we are supposed to do this. So we're not restricting them. but we're giving them that option that, look, if you got to do this, you got to do this too. So that's what I always do in my practice, that I bring like a tooth model, and then after that I teach them, hey, do you want to, learn how to brush? And then I teach them how to brush their teeth. And yeah, so we go on from there. And then after that, I see like the progress is pretty good, because we're not restricting, but we're educating them.
Yeah, totally. Educating them is most important. So we will come to that lovely demonstration of yours. I think we have some more questions in which you can really show us live how to, do that. So thank you so much for that answer. Moving on to the next question. I often have foul smell in the mouth. I think this is a very, very common question. This is from one of my friends back in Jakarta. I often have a foul smell in the mouth and I don't have any tooth decay. Dentists say I have good set of teeth. How do I know if I have any dental condition which is causing this foul smell? Your views on it, Dr. Kirti?
Okay. So basically, the thing in the mouth, which is called dry mouth, it's called dry mouth. Okay. So basically, it's because of the viscosity of the saliva, right? So this is caused because of many factors. If the dentist have said that the teeth is good already, then we have to look at other factors, right? So viscosity of the saliva is actually also connected to stress. So you have to check, are you getting stressed very often? It's connected to certain medicines which we take as well. So what are the types of medicines? And mostly what we see in our dental practice is also, it's also very connected to acid reflux. So that, excess of acid reflux, which makes, acidic, the mouth acidic. So that's why the dry mouth. That's what we call it in medical conditions, dry mouth or xerostomia. So what I would suggest, if the teeth is fine, then you must check up with an internist to see what is actually the problem beyond the teeth.
So would you like to give her some tips to manage this dry mouth, or she has to visit a physician for that?
So yeah, sure, I would give some tips. So what I would say first of all is, if you're using a mouthwash, don't use a alcohol-based mouthwash. Okay, so I'm not gonna name the brands over here, but when you read the when you read the contents, it should not be alcohol-based, basically. So it should be non-alcohol-based mouthwash, because what alcohol does, it makes the mouth also, it basically makes it worse, the condition.
Okay.
Makes that foul smell worse.
Okay.
So basically that you have to avoid that. The second thing what you can do is you can gargle your mouth frequently, right? The third thing which many of us say, and which I would suggest, is like probably eating like, what do you call this in English? Long
Clove.
Clove, yeah. You can like suck on the clove. So I want like a lot of natural remedies. So you can suck on the clove, or soft.
Yes.
Soft, yeah. So soft has a very nice smell, right? It's a very nice, so yeah.
Good.
Otherwise, yes, correct. Yeah. What many of us say is that you should chew this non-sugary, like sugar-free gum. But for me, I would suggest the natural stuff, soft, long. That's better for me.
I think you would be benefited by these home remedies, sucking on long and stuff. I think would be a better option than going in for something, which has chemicals in it. And I think she should keep in mind that she doesn't give alcohol-based mouthwash should be avoided, right? Okay. Moving on to the next question. I think this is again a very common issue with we ladies and we children and we men also. So it goes like, my gums bleed sometimes. Is it kind of a mouth disease? There are various questions. Should I be concerned about it? Could you please tell us more about the mouth diseases? So there are 4 questions for you, Kirti, Dr. Kirti. So what is it? What kind, is it a kind of a mouth disease? Gums bleed, of course. Then what mouth disease? Should she be concerned, or could you please tell us more details about the mouth disease?
Okay. So first of all, gums bleeding. How much is it bleeding?
Mm-hmm.
First of all, you have to see how are you brushing your teeth. Because
Okay.
many of my patients, you know, when we just see, okay, how they brush their teeth, I observe, for example, how are they brushing their teeth? Then I teach them the right technique of brushing. I observe again after a week or so. And then I see, oh, actually, it's just the technique of brushing, which is kind of has to be moderated, right? So that's the first thing. Second thing, maybe you could have a gum problem or a periodontal problem that you would have to check it when we see, for example, how much calculus is there. So if the calculus is basically the sticky deposits of food which is stuck on the teeth and which can't be taken out by a toothbrush. So if you have that, then it's very likely that you have a gum problem or you have a periodontal problem, right? The diseases of the mouth, you don't have to worry too much. If you said that the gums bleed sometimes, that means we have to focus more on the brushing of the teeth and more on your regular checkups.
Okay. Sure.
It can be 6 months after. So maybe you haven't done a cleaning, nearby during these 6 months or something. Then yeah, that should be done ASAP.
Okay. Right. So there's a next question again based on oral health and brushing. So I take care of my oral health by brushing them well, but I'm still worried if my mouth will smell. What is the sign for poor oral hygiene?
Okay. Signs for poor oral hygiene. Right. So let's focus on signs for healthy teeth and healthy oral hygiene. Okay, but since you're asking, I want to say signs for poor oral hygiene is that, for example, you brush your teeth and it bleeds. It frequently bleeds. That is already a big sign of poor oral hygiene. The second thing is that for example, you feel that the teeth is like, so when we feel with our tongue, we can feel that the teeth is a bit rough on the surface when you do this. Yeah. That means that there's a rough area over there. Now that rough area is called calculus. So when you do this with your tongue, or when you do something with your tongue like that, you're supposed to feel very soft and smooth. The moment you feel that there is something hard, there is something there, or something is there, then it is already a sign of poor oral hygiene. Okay. Third is sensitivity. Now sensitivity also you have to check. Why is it sensitive? Is it sensitive because of a cavity? Is it sensitive because of the gums? So these all things you have to really take in mind. And the best thing I think would be just to check it up rather than thinking too much about it. Just check it up so that we can know what actually is the problem. The problem might be very small, but if you don't check it up, you'll be overthinking about it, what the problem is. So I think check it up, get it checked, and we can just solve the problem then.
If I'm allowed, you have a set of tooth and a brush there. It'd be very nice of you. Like many of us are watching this show. There are small children also watching this show. So I would request you to demonstrate to us what is the correct way of brushing it, Dr. Kirti. Will that be possible?
Perfect. I think that's amazing. Thank you.
Okay, go ahead.
So, So what you have to do is, first of all, when you take the toothbrush, you hold it in a very gentle way. Don't hold it like this. Just hold it in a very gentle way like this. Okay. And put a bit of the paste. And what you do is that you go in a circular motion, right?
Could you bring that little higher? Yeah, that should be fine. Yeah, that should be fine.
So this should be in a circular motion, right? Is this okay?
Yeah, that's fine. That's fine. That's fine.
Circular motion. So you're going actually in a circular motion. You're not going like this.
Yeah.
Yeah. Why are you not going like this? Because you see, you're going to damage the gums,
Yeah.
right?
A
So
little
you
higher,
go
Kirti.
circular.
Little higher, doctor. Yeah,
Sorry.
yeah, yeah.
Circular, 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 and circular here, right? And then when you open the mouth, right? Over here, you just go, sorry, I'm just adjusting this. So you just go like this. And the front part, what you do is you do this. Never do this. Never go horizontal, always go vertical on the inner sides, right? And you do this. And for the inside part also, you go like this. So basically, it's just either you go like this or either you go circular. That's whatever you feel comfortable, but never ever damage the gums. So what I would say, just to make it easier for beginners, let's just make it very easy for everyone. Let's just go circular in all areas. Circular, except for this inside part like this. But other than that, you can just go circular. See, circular. Your hand movement should be circular basically, and it should be a very soft, gentle movement. So we're not really. So people think that the harder you brush, the more effects will, we'll get better at it. We'll get more cleaner teeth or something like that. I've heard a lot of people say that, but it's actually the technique of brushing. So what I would say is I would make it very simple for everyone. Circular. Just go circular. Everything should be circular, very gently, and take a medium toothbrush. The bristles should be medium, not hard or not soft, just medium.
Right. That was great. I think we had a very lovely explanation by you, Kirti, on how to, keep our, the brushing in a circular motion, and that will help us a lot. Okay, my question is moving on towards the teenagers. And there is a mom of a teenager who's really concerned, and she says, my teenage daughter, aged 16 years, always wants clean white teeth, like how they have it in the advertisement, how they show it in the ads. And she is very conscious of it. Should I consider teeth whitening treatment for her? Need your views on that.
How old was she? 16, is it?
Yeah, she says she's 16 years old, Dr. Kirti.
Okay. So 16 years old, yes, you can consider teeth whitening. Teeth whitening is completely safe if it's done by a professional. So you can consider teeth whitening if you're looking for the whiteness of your teeth. And oral hygiene is different, right? First of all, oral hygiene needs to be taken care, and then the teeth whitening. But yeah, definitely teeth whitening. So what I would do is, because they're in their teenage years, right? Their teeth are so sensitive, and this whitening agents are so sensitive for the teeth. So what I would do is I would just take care of it in a different way. Like I would actually, put some fluoride in the teeth first, and then, make it less sensitive so that the patient is actually calmer. So when they go back home, they don't feel that sensitivity. So yeah, I think it's perfectly fine to do a teeth whitening. It's totally cool.
Okay, so I think she got her answer there. So, ma'am, you can go for it. Dr. Kirti says it's fine because she's 16 years plus. Okay, the next question is, these days we take care of our health. Yeah, we all are taking care of our health, and we all have balanced food to keep our body fit and fine, right? So I would like to know what food are to be, good and bad for the teeth. Could you explain it in detail, Dr. Kirti? Is the question. I mean, Dr. Kirti, I'm adding. She says, can the doctor explain? Okay.
I will remember that slide, miss, I showed? I did not explain it actually. So maybe I will explain that slide for a bit.
Okay.
And then I will just share screen.
Well, sure, sure. Yeah. Yep. It's seen. The screen is seen.
Yeah. So this is the one which I wanted to explain. So
Sure.
this
Sure.
is our teeth, right?
Yeah.
And whenever we eat, there is bacteria, of course, like everything we eat, there is bacteria form, whether you eat healthy food, you don't eat healthy food, right? But what makes a difference is this, that when you don't eat healthy food, when there's a lot of sugar content in the food, this sugar plus the bacteria, okay, will make the plaque in the mouth, will make that bacteria just stick in the mouth, right?
Mm-hmm.
Now, why we say time? Because time is, some people like to snack on, like when they're working, they snack. When they're doing something, they snack on it, right? They snack foods, right? So basically, time also plays an important part in making cavities, in forming cavities. Because if you keep snacking, then the saliva doesn't have time to neutralize in your oral cavity, right?
Mm-hmm.
So then there's no time for the saliva to actually naturally cleanse the teeth. So if you keep snacking, there's no time for the saliva to naturally cleanse the teeth, and that makes a tooth decay. Now, what foods are good is what we would suggest has a lot of water, right? So for example, citrus fruits, oranges, right? Apples, those kind of fruits have a lot of water in it, which will naturally wash away all the bacteria, right? It's a natural process, right? It's a natural body process in our oral cavity, right? What, of course, to avoid is, of course, acidic, because acidic can make our teeth very sensitive. It can make our teeth like more prone to cavities, so we can have different cavities in different areas. So acidic foods, and foods which contain a lot of soda, and drinks like Coke and all that contain a lot of soda, it can make cavities in the upper part of our teeth, which not many people know, and that's why we prevent it. So basically, just like mineral water, fruits which have a lot of water, foods which have a lot of water, which have a lot of fiber, broccoli, you can eat carrots, of course. And of course, this is basically the main things what we all know. Strawberries, it's good antioxidants, right? So all these things make a difference. Now, what I would say, if you have sugary foods, just be more concerned about when you're brushing your teeth, and you make sure that you gargle your mouth at the right time. That's what I would say. Like, 1 minute. So gargling your mouth is very important, because when you gargle your mouth, it just takes away all the sticky stuff, which prevents plaque.
Right.
So yeah, that's what I would like to say. I think it's very basic things, but which should be kept in mind. Yeah.
So it's generally that it's like acidic things need to be avoided, and more of water and more of fruits and which has water content in them, that has to be taken, which will help them out, right?
Yeah.
So yeah. So my next question is about middle-aged friend of mine who wrote to me. He said, I'm past middle age. I got my root canal for my wisdom tooth, yet the tooth is painful. What could the reason be? Do you think I need an implant? Dr. Kirti? Hello?
I'm here.
Can you hear me?
I'm here. Yes.
Okay. So that question was with the middle-aged person asking me. I'm past middle age. I got my root canal for my wisdom tooth done. Yet the tooth is very painful. He has not mentioned the time when he has got it done. What could the reason be? Do you think I need an implant? What are your views on this, Dr. Kirti?
Okay. So first, I'm not sure if the person is here today now, but we have to ask when the root canal has been done, right? And then the second thing is that um, if your teeth is hurting because of the root canal, because you have already done a root canal and it's still hurting, why is it still hurting? It can be because of a gum problem, right? So a gum problem can also make the teeth hurt, because the teeth, is generally not vital when you do a root canal. So the teeth can hurt because of a gum problem. It can hurt because of a impacted tooth. For example, when we bite and he has put a cap, for example, he has put a cap in the root canal and the cap is not proper, the teeth can hurt. So we have to see according to the X-ray and the condition of the oral cavity. Ms. Saraswati, am I audible to you? Wait, I think you're on mute.
Unmute.
You're on mute.
Yeah, that's, I think when people were there, I got just unmuted by the host of the show. So anyway, so I hope the person has, so you need the X-ray for a better reading, right? For better understanding, right?
Miss, I would suggest that, see, when you do a root canal, initially the teeth is not supposed to hurt, okay? But maybe the teeth can hurt because of the gums, or the teeth can hurt because of the cap, which is not proper yet.
Okay.
And how long has the person done? So all these things need to be evaluated.
Okay, okay.
You know?
Yeah.
Then we can come to know, okay, for example, and for the anamnesis also, further question and answer with the dentist. So for example, if the person is there, I can, straight away ask them maybe, and then we can find a solution to it if they are there.
Yeah, I don't see that person there, Kirti. Maybe he's listening to us over the live FB live. So
Right.
probably he will get back to us once he's on the show. So can we move ahead? Can we go ahead? I mean, if he gets back to us, I will. Okay, now I have a question on my WhatsApp here. I would like to ask you this question. It's come on my WhatsApp just now. He says, as we age, we lose teeth due to drugs, medicine, and also aging process. What is the best solution, implants or denture? Now that we are dealing with implants, so probably this has come up. So this is on my phone here. There are two questions which has come in. The first one is this one. I mean, you want me to read the question again?
No, I got the question. I think it's either implants or dentures, right?
Yeah.
Yeah. So basically, implant and dentures, they have a lot of pros and cons to it. For example, let's see the age of the patient. If they are slightly
this is what 50 plus. If I know him, he's 50 plus.
50 plus. Okay. Yeah. So 50 plus, any systemic disease or not,
no.
Right? So for example, we have to see, okay, no systemic disease. Then we have to check the bone density, bone density or the jaw to bone density. How much is it? Right? So if the jaw to bone density is okay, then it's okay to do an implant considering no systemic disease and considering what their dentist has said, because their dentist has checked them. They have the scan.
Hopefully.
Right? Usually when we do an usually when we do an implant, I also take a CBCT scan. So it's not just an X-ray, it's also a CBCT scan to know the jaw to bone density, right? So now what about dentures? Okay, dentures is also good, right? Dentures are also good, but there are certain disadvantages of dentures is that sometimes if you put a fixed denture, so there are fixed removable dentures and there are fixed dentures as well. So sometimes the fixed dentures can go malpositioned. They can go out of place at a certain years. But sometimes those dentures are the only option for the patient because they have systemic disease or their bone to jaw to bone density is pretty low and the implant can't be put in over there.
Okay.
So then you have to see according to the oral condition and according to the X-ray as well. So it's a very general based question, which I would suggest if we want to go further in it, we have to see all aspects of it.
Okay. Good. Thank you so much for that, Dr. Kirti. And I think we will move on to the next question. We have this question which says, I use Philips electric toothbrush for brushing. Some people suggest that I should avoid using them. Please clarify what's the right thing to do. Is using electric toothbrush better than manual brush? What is your opinion on that?
Okay. So there are so many patients asking this question, and I'm really glad this question has come up.
Uh-huh.
Um, there is no good or there is no bad in this. It is just what suits you, I would say. So for me, I would prefer a normal toothbrush, not an electric one, because I can control the speed of it and I can control my hand movement of it. As long as you know that you have to go in a circular motion, like how I thought previously, right? Then you're fine, you're good to go. You do not need an electric toothbrush. Electric toothbrush is basically just to assist you so that you go in that circular motion,
Mhm.
right? Some patients find a lot of sensitivity after they use that. So it
Mhm.
just depends on patients to patient. So if you're finding sensitivity, then stop the electric toothbrush and go for the normal one. If it is fine with you,
Mhm.
then continue it, it's fine. So you have to just see accordingly what suits you.
Okay. So it's my personal question. I just wanted to ask you. See, now that many patients of yours ask you regarding this, what is the general mindset? Is it laziness, or it's just that they feel that when something done through using a machine could do a better job? What is the mentality behind this? Is something very personal. I just want to share it with you. So if it is laziness, I think it's better they overcome the laziness and they start doing that circular motion stuff. What is your opinion on that? Just a light answer. It's not like I
Yeah,
just a thought of mine which came in, and I'm just asking you in the show.
I'm glad you asked that actually, miss.
Uh, uh,
So, for me, what I see mostly in patients is the second one. It's where they think that because it's with a machine, it's going to be cleaner and better.
mhm.
But actually, when they realize that this is actually the technique, this is actually the right technique, and the machine is actually doing the same thing, it's going in a circular motion,
Yeah.
then I think that they will their mindset will be shifted. So it's the second one. Laziness not so much,
Mhm.
because they will also have to use the brush and get up and use the brush, so it's not
Yeah.
laziness. For me, I see a lot of people just thinking that, oh, it's with the machine, so it's going to be cleaner.
Mhm. Okay,
Mm.
great. So I'm because you have already demonstrated and you've already discussed about plaque. We have I have that question that can flossing help clean plaque?
So flossing can help clean the food in between, like what I showed in my previous
Yeah.
slide. Like for example, there's the food stuck in between. It
Yeah.
just takes that out because a brush cannot fit in there, right?
Mhm.
So a floss would take it out.
Mhm.
And yeah, flossing really helps in reducing cavities. Actually, what I would say is because there are a lot of so if we see this part, like I have a pencil here.
Yeah.
So, for example, there is this, I hope everybody can see now. So
Yeah.
there's this food stuck here, right, in
Yeah.
between the teeth.
Uh,
Now, if we take it out with the floss, if we're taking it out with the floss,
uh,
it reduces the cavity in this area, in
mhm.
this middle area,
Okay.
basically, right?
Mhm.
And where the cavities are formed is basically in these areas where
Mm.
the toothbrush can't reach, because
Yeah.
you can't use a toothbrush in this area. You can only use it to a certain extent, but flossing is that string where you can just go in between and take it out.
Yeah.
So it really prevents people from getting cavities.
Mhm.
And yeah, it's
Great.
very good. It's actually helpful. Yeah.
Oh, good. So that I think that question got answered. So now the next one is about a diabetic person, and he writes, it's this is him. Okay, so I'm diabetic. I have tooth decay, which I just got fixed. Are there anything more I need to do about my dental hygiene associated with diabetes? So he's a diabetic patient, and his idea is anything more to, he got it fixed, of course. From your point of view, Dr. Kirti, if he's a diabetic, what more precaution has to be taken?
So for diabetic patients, it's very important to take care of their oral hygiene because they're more prone
Hmm.
to getting this tooth decays,
Mhm.
right? Because their gums are very sensitive. So what I would say for diabetic patients is that they should, instead of just 6 months, they check to the dentist. Sorry, instead of just 6 months, they check in the dentist. They should go for more frequent checkup for 3 months, because when we're seeing the gums, the gums are so tender of a diabetic patient. So when we're seeing the gums, they check every 3 months. We can control their dental hygiene. So that is one way. The second thing of a diabetic patient is that there is a lot of plaque. So I would just like to share my screen over here.
Yeah. Yeah, there.
Yeah, so there's a lot of plaque stuck in a diabetic patient from my experience, which I see like there's a lot of plaque stuck in the middle and at the back of the teeth. And this is what I was saying, those rough areas which which were supposed to feel soft. And that is one of the things that we find it rough at the back of the teeth. So there's a lot of calculus stuck over here and outside the teeth also for diabetic patients, which make their gums inflamed, and then which in turn makes the gum recede, and which leads to tooth loss.
Sure.
You know. So for diabetic patients, I would suggest that be more frequent in your dental checkups, and don't be afraid to go to the dentist, because it's just something which I think, which is like how you go for your daily routine, for your routines checkup to your internist. It's just the same thing as that.
Right. Right. So because being diabetic, I think they have to be careful with everything, right? Because it is something which causes the whole body to react, right? Diabetic. So I hope my friend has heard you, and he knows what more need to be taken care of. Okay. So there's one question from a teenager. We had a question from a teenager mom. There's another question from the teenager, which says that my daughter requires braces, but she is shy to use braces. Is there any other alternative?
Okay. I get this question a lot from people. Okay?
I'm sure.
Yeah. They all want to go abroad and they want to use braces, but they're so shy. Right?
Yeah.
So there is this thing called Invisalign. Okay, so basically these are invisible braces which you use. So this thing is like, it's pretty cool actually, because when you use this Invisalign, you don't need to come to the dentist like very frequently, like when you use braces. Okay. And then you don't need to make sure like what you're eating. You can just eat about anything. It's practically invisible. Maybe I will share the picture with you, Ms. Saraswathi.
Sure.
So you can post it in your social media. But it is something which is really an alternative, and it has no wires. Like braces has wires, right? Like they have broken wires. Patients have to come. They get like ulcers in their mouth and stuff. So Invisalign has nothing. Yeah, and it's painful. So Invisalign is lesser painful, no wires, lesser coming to the dentist. And Invisalign is pretty easy. Actually, you just come in, we'll do a scan of your teeth. And then after that, you can see the treatment plan already. I would love to share it maybe next time if I come to your show.
Sure.
Again. So yeah.
So will it be expensive? Just give us that thing. Will it? Then naturally, it's because it's going to be invisible. It's going to be more stylish, so more cosmetic prone. So it's going to be a little expensive. Let the parent know about it before they choose for this option, right?
Are you asking me about the?
Yeah. I'm asking you. I'm asking you now that the braces thing has come, and definitely because it has more of a cosmetic effect to it. It's definitely going to be a little more of a in a higher range than the normal braces thing.
So you got to choose beauty or expense.
Yeah. Beauty is expensive. I think it's better to stay natural and get into the braces with the normal stuff.
But the teens don't want that.
Yeah, I understand. Okay, now moving on to the next question. I think we've all gone through this COVID era. We are still going through this. So there is a one question. I mean, every field has this question when we come for COVID. So how has your experience been working with patients during COVID times? How safe is it for the patient to visit dentist at such times? Over to you, Dr. Kirti.
Okay, thank you. During this COVID times, I think that I have taken much more precautions. You know, we are wearing the full PPE outfits, you know, 3 masks, and a lot of things, precautions for us. Now, for the patients when they come, so what I do in our clinic is that when the patients come in, right, I schedule the patients in a way where they're not all waiting at one time. We have it, for example, between this time to this time, and then after that, then they can just leave. So there's like lesser interaction of people, which really stops the spread. Okay. After every patient, the place is sterilized, and we have a UV ray in the clinic. So after every patient, the place is actually, you know, UV radiated.
Okay.
Yeah. So it is that intense, and we still do it till now. Because the COVID-19 is still going on, the pandemic is still on, even though we're still cooling off. But I think that that's very important, because the mouth is where all the diseases, you know, they kind of spread from there. Yeah.
So, okay, great. That and I wish you really safe practices, and you know, because it is mouth, right? And you're already taking so much of precaution, and then the patient should also be very, very confident to approach you, or the dentist who are taking care of all these protocols. You know, COVID protocols are being taken care of. I have one more question which has come in just now with related to COVID. And it says that I read that people with advanced gum diseases are much more likely to suffer complications from coronavirus. Is it true?
Yes, could you repeat that question?
Yes, I'll read it for you. It's am I audible to you? Okay. I read that people with advanced gum diseases are much more likely to suffer complications from coronavirus. Is it true?
Okay, so basically, if we're talking about coronavirus,
Gum
it all
disease,
depends.
coronavirus, I think, yeah.
Gum disease. So is the person asking if they're having gum disease, they are more prone to get the virus?
Yeah. No.
Are they asking?
He's asking. No. He's asking if you're suffering with advanced gum diseases. Is it much more? I mean, the complications can be more because of the coronavirus in the atmosphere, or will it enhance the complication? Like, if a person is already having gum disease, so will coronavirus complicate the issue more? What's your opinion on it?
If they don't have the coronavirus, then their gum disease is going to their gum disease in itself is going to complicate the dental hygiene.
Oh,
so it's not because of the coronavirus situation or the pandemic situation, it's because of their oral hygiene.
Okay.
So if they don't have the virus, then it's their gum disease which will complicate the situation. Like what I hope that they saw that slide where I showed that because of their gums, then their gums recede, tooth loss and bleeding and all that, like from A to Z. So I think that is very important. So I don't think that, what I would like to say is, because I'm a dentist, what I would like to say is, I just want to give a simple tip to the patients is that don't be afraid to go to the dentist. You know, we're all friendly people. We all love to see you.
So don't
be afraid. Fairies. Yeah.
Angel and fairies down there.
I think Miss Saraswathi, you can vouch for that.
Yeah, when I come to Jakarta, I think Kirti will be the most sorted dentist for me.
So don't be afraid to go to the dentist. The second thing is that don't be afraid because of this complication, this could happen or that could happen. I say that just go to the dentist and just check your oral hygiene, I think. You know, it's not as complicated as we make it sometimes.
Yes. Okay.
You know,
very true, very
it's just that you just have to go out there and check up. Sometimes we pend our dental appointments. We say this is not important, but because they say it's not important, that's when they get worse.
Yeah.
So I would say if you have a bit of problem, it's okay, just come by. Or just come by and, you know, make an appointment and say hi to me. You know, it would be cool.
Because, yeah, I'm sure, Dr. Kirti, I think, and for a better smile and to keep it smiling, you need to have a good set of.
Yeah.
And for
As
that,
you said, like that,
dentist is really important.
yeah. As you said, like 50% of the people see your smile when you're talking. Yeah.
Yes, yes. So I think we are coming to the end of the question answer session, and I had a few on my WhatsApp, and I was very kind enough to take up those questions also. So I want to thank you for you know, coming over to my show, Dr. Kirti, and your persona, the smiling persona, was so great. And I'm sure the people who are watching this show also must be very, very you know, affected by the smile, and they can see that they're. So yeah, yeah. So I want to say thank you for coming on Manthan with Saraswathi. And I also want to tell people who are watching, I'm so proud that it's my student Kirti, who is Dr. Kirti now, and she is on my show. And this gives me immense pleasure. And I feel in Hindi, if I would say, like, I'll feel my jeevan safal hua, mera jeevan, that I could, you know, have my student on the show. And I feel so proud of you, Dr. Kirti. And it's been a great pleasure having you on the show. And before we close, what will be your final words on the dentals and, of course,
on dental, right?
or anything? It can be anything. Of course, on dental first.
So first, before my final words, I want to say something. So I think that it's an honor for me to be here with Ms. Saraswathi. You know, she is a very, very energetic teacher, and whoever knows her knows that she is super energetic. She's just super full of life. So when, you know, I'm her student, but, you know, the way she approached me was totally so humble, and she's just so humble, and you just feel so comfortable with her. I think I felt one of the most comfortable in these sessions, you know, just sitting down and just like, you know, the way she asks you the question, you feel that comfort level with her, and she can just connect with everyone. So I feel that she has a very heart-to-heart connection, and I just wish her all the best for her, you know, her live session, her Manthan, right, Miss?
Yeah,
Manthan, right?
with Saraswathi.
Manthan with Saraswathi. So, you know, I just hope that more and more and more people see, because she has a lot of good episodes, and I'm really honored to be here, Miss. I really say this with all my heart, that I am really happy that, you know, I am one of the students which got to be part of this. And thank you so much. You know, I'm really, really, really honored. And thank you to, Uncle Suresh as well.
Yes.
You
He's
know,
the backbone behind the whole thing. And I was keeping my fingers crossed that he should reach home on time so that we can have the session on time. So he is the backbone, definitely, Kirti. And you got it right. And I was about to thank him for that. Well, you have mentioned it. So yes, thank you, Dali. Thank you very much.
Always. I really thank Uncle Suresh. He really is, of course, the backbone, and both of you are really doing amazing, and just keep shining. And I really hope that we meet again.
Sure, we will.
My takeaway for dental, I think dental, a lot of people have heard me and saying, but what I would say is, I said it before, that just come to the dentist, just check it up, and you know, your problems can be just solved like this, you know, instead of prolonging it. And what I would say for my motto is, just believe in yourself, because many people would say you can't do it. But when you are just yourself, and when you go out there and you just be your original self, that's why I think the magic happens. And that's what I think, you know, I learned from Miss Saraswathi also. She's just herself. She's just her bubbly self, enthusiastic, energetic. And which she was also telling to me that, Kirti, you are so enthusiastic and energetic. And I think that both of us really have that, thing with us. So I think, yeah, just go for it and be yourself.
It's so lovely to hear these things from my student, and I feel blessed. And I think the energy connected somewhere, and I think we will be connecting more again on what the progress you make, and definitely we will be in my show. And thank you that you have taken your time from your busy schedule, and you're there to to be talking to me about the questions which has come in about the dentistry. So finally, I would like to thank my husband, Mr. Suresh, like you did, Kirti. I would personally like to thank my husband, Suresh, for all the effort and, the technical support which he gives me. And yes, it is bye-bye from Manthan with Saraswathi. And thank you once again, Dr. Kirti, for having us, for being here. And it's a great pleasure once again. And this is Saraswathi signing off and saying bye-bye with Manthan with Saraswathi. Bye-bye.
Bye, guys.
Bye-bye. Love you.